is with great pleasure that I welcome you all as we launch Kenya's Macro-Fiscal Analytic Snapsot, a flagship product by the Institute of Public Finance. The Institute of Public Finance is a premier think tank based in Nairobi, Kenya, but working regionally, that aspires to further the principles of transparency, accountability, and participation in public finance management in Kenya. Our vision, our outlook, is to become an independent think tank that delivers unquestionable evidence in public finance management for policy and action. We do this through quality advice and engagement to enhance equity, responsiveness, transparency, and accountability within public finance management. With that background highlighted, today we are here to hear or to listen to our colleagues and our teams from IPF to tell us about research undertaken on Kenya's macro and fiscal outlook. We will hear from our CEO, who will give us the objective and the framework within this work was undertaken. We will hear from our senior research analyst about the key findings of the report, and we will hear from our country lead, who will spotlight the key messages and the implications of the findings from our report. Thereafter, we will have a session for question and answer and a wrap-up session as we finish the launch. Without much ado, and in the interest of time, I welcome our CEO, Mr. James Muraguri. Karibu, sir.
Thank you, Ruth, and good morning, colleagues. As been rightly said, my name is James Muraguri, and I'm the Chief Executive Officer at the Institute of Public Finance. The Institute of Public Finance, we are so privileged to have this opportunity to be able to scrutinize the public finances in Kenya and be able to make solid recommendations as we look at how 2023 looks like with regards to the economy. The Institute of Public Finance was founded in 2013, and in 2023, we are literally celebrating our 10th year, and over years, we've become the go-to point for partners with regards to evidence as regards public finances in Kenya. And our focus is rooted on 6 strategic areas, which includes, supporting formal mechanisms of public participation in the budget process, looking at how oversight institutions are looking on public finances, supporting the development of PFM resources, human capital, mobilization of citizens to participate in the processes, as part of participation mechanism, developing such products that we are launching today, the analytic snapshot, macro-fiscal analytic snapshot, and of course looking deeply at our debt, public debt, and this, public debt as a standalone element calls to us, to look, as looking at those dark corners of our budget. As we launch the 4th edition of the macro-fiscal analytic snapshot, the purpose of this document primarily is to facilitate an active and informed public discourse on the economy and public finances. And this document has been developed through an in-depth analysis, scrutiny, interpretation, and dissemination of publicly available information on Kenya's economy and public finances, to develop an analytical, yet a very solid and compact report. The 4th edition of the macro-fiscal analytic snapshot comes at a time when it's barely 6 months since the new government took over power and has taken over power with commitment towards fiscal consolidation and alignment of our public finances. And this fiscal consolidation comes with also demands for higher tax revenues and also looking at how our public debt situation looks like. This snapshot will also give feedback on what we think would be the key messages for 2023 and issues that we seek to monitor as a think tank, and giving them out to Kenyans to look at them and monitor as we continuously put our government to account, and also give the government feedback and give them insights on what they need to look at with regards to the economy. I'm privileged this morning to have led this team that has done wonderful work on developing the snapshot, and I'm sure as we go towards the sessions as led by my colleagues, per section on how this document looks like, we will be able to interact with those who are viewing us online, and we are happy to take feedback, and we will ultimately disseminate this document to the country immediately after the launch. Thank you very much, and I invite you to engage and enjoy and be informed by the presentations being made by my colleagues. Thank you very much, Ruth.
Indeed, building strong evidence is an indispensable focus for the Institute of Public Finance, and that is the core purpose of this report. Today we are launching this report at a time when there's a lot of dynamism going on economic activities in our country. We have the draft budget policy statement presented by government, we have the supplementary budgets coming in, and planning and budgeting for the financial year 2023-2024 coming up over the next few months. A central objective of this event is to introduce our report and to bring to the fore the key findings and the key messages that should help shape the conversation around economic planning in our country. I would like to take this moment to welcome our senior research analyst, who will take us through the details of the findings in our report, covering macro and fiscal indicators, revenue and expenditure, donor assistance, public finance management institutions, and a deep dive on the health sector. And with that, I welcome our senior research analyst, Bernard Jiri, to take us through the first part.
Thank you, our CEO. Thank you, Ruth. And it's my pleasure to take you through the macro and debt section. And I will start with the macro fiscal indicators. And going to 2023, we foresee a situation where the economy could grow at a rate of 5%, contrary to government projection of 6%. And we attribute this first to climate change related challenges. As you know, many Kenyans are struggling even to afford basic commodities. We have inflationary pressure that is biting our economy and the entire world. And we also have a predicted global economic slowdown. As you're also aware, the shortages were not even adequate, and we also foresee that fiscal consolidation could also slow down our economic growth. Then we also paid keen attention to our fiscal deficit, where government in fiscal year 2023-2024 is targeting to reduce the deficit to 4.2%, of which it's really ambitious to cut a budget by more than 1%, at a time when the economy is struggling and we didn't need to spend on, we didn't need to increase our social spending to cushion poor households. Then regarding public debt, we have seen government is still trying to borrow more and more. And we also foresee a situation where the debt therefore could exceed the forecast for 2023-2024 as per the macro poverty outlook. And this is because first, we expect a growth setback, and this growth also in debt to finance the 2023-2024 budget, as it has been proposed in the draft BPS, that could also lead to a rise in public debt. Then we also looked at investment and also GDP now in details. And the outlook for growth and investment is better than originally predicted at the outset of the COVID crisis. And Kenyan economy demonstrated a strong resilience by bouncing back from a contraction of 0.3% in 2020 to above 7% in 2021. But we expect a slowdown in 2023. And compared to the forecasts that were done or were made in 2020 and 2021, GDP is still lower than the pre-COVID level, but investment has at least recovered very fast. Then Kenya, compared to other peers in Africa, such as Nigeria and Ethiopia, we have seen the economy has not experienced biting or very high inflation compared to Nigeria and Egypt and Ethiopia. Sorry. Although we have not seen much involvement with of the central bank in trying to stabilize price levels, perhaps they are treating the existing inflationary pressure as transitory. But Kenya has done quite well, although our inflation level is above the upper limit of 7.5%. And what that means is that our poor households are really suffering because of low purchasing power. And then we also realized that price levels in Kenya at this time are largely driven by food prices. But there is a room for fiscal consolidation to help in addressing this issue of inflation by government first doing away with the non-priority expenditures. We also looked at recovery in the consumption and poverty, and we realized that consumption per capita, that is consumption per person, has remained quite low compared to the levels that were projected before the pandemic. But as you see, from 2021, it has recovered, but gradually. But regarding poverty, we have really lost in terms of poverty reduction by like 3 years compared to where we could be if we did not have COVID hitting the Kenyan economy. But this trend is actually good, the way we have monitored, because it's showing us that Kenya is rebalancing towards a more sustainable growth. Our other area was fiscal consolidation. And in 2023, 2024, we expect the government to reduce expenditure and also to try and cut fiscal deficit. Although previously government has missed fiscal deficit targets, but at this time there is limited room for government to borrow because we have tight monetary conditions where now global interest rates have risen and the cost of borrowing has actually risen. And that leaves the government with a limited room now to borrow externally because of that high cost. And as you could remember, last year, it even forced the government to cancel the Eurobond in June last year because of high cost of borrowing. So at this time, there is limited room to borrow, so the government has to reduce expenditure and also mobilize more revenue internally. And then we have also realized that in 2022, the fiscal gap actually reduced because government reduced expenditure, and also performance was good in terms of revenue. And after a long period of high deficits and expanding public debt, there is now a signal that government could be pursuing a commitment to fiscal consolidation. Although we will monitor this to see whether government will still continue in borrowing if borrowing conditions become favorable. Perhaps the decline that we observed last year was because of the constrained fiscal, the constrained financial conditions, or the tight financial conditions globally that forced the government to seem to be committed to the path to fiscal consolidation. But when we now monitor fiscal deficits and public debt, we see there is a signal that government could be pursuing fiscal consolidation. And then we also paid keen interest to see how the economy is doing in terms of external debt. And since 2022, we have been breaching the baseline when we monitor external debt sustainability. And that's why we have actually highlighted the projections for 2023 in red, because it tells us that Kenya is actually much more vulnerable to external shocks. And it now caused for the government to take the necessary measures to operate within the threshold. Otherwise, we might find ourselves in a situation such as Ghana, who are now unable to surface external debt. We would not like to get to such a point, and therefore having our external debt sustainable is of great interest. And now I want to move to the next section where I will take you through revenue and expenditure. And this conversation is coming at the right time when the government is targeting in the financial year 2023-2024 to mobilize more resources in terms of revenue to finance the next budget. So we also analyzed the trend historically to see how possible is it even for the government to meet the target in the next financial year. And it's good at this time because we have the draft BPS out for 2023. And we observe that revenue performance rebounded in 2021-2022, and actually the government for the first time in several years exceeded the target. We surpassed the targets. And when we look at revenue targets versus the actuals, that is outturn, we can see government is now more realistic in terms of setting revenue targets compared to previous experiences. And another thing that we came to observe is that tax expenditures in Kenya have progressively declined, but now what we want to see moving forward is an assessment being undertaken on economic implications of these tax expenditures. That report is not there, and it also needs to be published so that citizens can know what we are sacrificing, and then we should also hold the government to account so that we can see the benefits of us sacrificing in terms of tax expenditures. Then revenue optimism has been driving the country into more borrowing, because we set very high revenue targets and then we fall short of those targets and we end up borrowing more. But in recent years, we have seen that optimism adjusting, and also there is that commitment that fiscal deficit could be declining, although we are still keen to see if government will achieve the target fiscal deficits. And like I said, because of the prevailing market conditions, especially for the frontier markets such as Kenya, now government has no option but to undertake fiscal consolidation. The cost of borrowing is definitely high, and borrowing more could actually make Kenya more and more vulnerable due to debt. And debt growth in debt, again, is not really good because it erodes investor confidence. It might actually work against the target that we have in terms of even undertaking capital projects. On the expenditure side, real expenditure is stagnating and real per capita spending has declined. And what we really mean by this is that we take allocation or we take expenditure, then you adjust for inflation. Then if you divide that by the number of people or the population, you see the amount that we are spending per person has been declining. And what that means is that service delivery is also affected. And this is due to fiscal consolidation as one of the cause. Then we also, government has also indicated that transfer to counties will also decline. And that is really disturbing, and also raises a question on the commitment to even strengthen devolution. Because if we cut transfers to the counties, it will definitely impact service delivery, especially to key sectors such as health. And that is something that we have also paid keen interest, even going to the 2023-2024 budget. And because of that, and even as we look forward to having a budget that is addressing the issues of equity, we have taken seriously that indication of transfers to the counties being cut or being declining. And we looked at, we have also gone a step to look at the proposed BPS or the draft BPS for 2023. And it's really disturbing to see that county governments will only receive 1.4% increase. So compared to the national government and the CFS, we see that counties are really losing. And why do we say that counties in the next budget are losing? It's because we have an inflation currently that is above 9%. And you are being, we are adding 1.4% to the counties. So in real terms, counties are losing money. And that now also requires the Senate as the institution mandated to look for the interest of counties, also to pay that keen interest in terms of making sure that counties are adequately funded. Now, in summary, Kenya has begun a difficult period of fiscal adjustment predicated on growth in revenue and painful expenditure cuts. And what we see is that large fiscal deficits and the buildup of public debt it has been as a result of revenue optimism, like I indicated. And then because of that, there has been erosion of fiscal buffers. And we saw how the economy struggled due to the COVID shock. And because if we do not have enough buffers, any external shock would be very strong on the economy, because buffers absorb external shocks. And that's why we are also raising the issue of Kenya breaching the threshold when we also look at external debt. Then even if revenue could reach 18% of GDP, as planned over the medium term, expenditure constraint will still be necessary because, like I said, we have that high cost of external borrowing because of factors such as tight monetary policy in developed economies. And the focus of the cuts appears to be on the current budget and transfer to the counties, and that is likely to adversely affect service delivery. And at this point now, I would like to invite my colleague, John Nyagi, to take us through the next sections. Thank you.
And now we look into the specific deep dives into the sectors that now are affected by the macro indicators and public finances, because those ones affect each sector and affect each one of us. When we have inflation, we have fiscal consolidation, we have expenditures in public finances, those ones affect each and every sector. So the report, as we did the research, we zeroed down on a few sectors that we took a deep dive to see how they're impacted by these inflationary pressures and also fiscal consolidation that are being undertaken. So we looked at the official development assistance, how has been disbursement of foreign aid into the Kenya, and what role does foreign aid play in the financing landscape in Kenya. So the findings indicate that if you can see these graphs, that from 2016, you can see that 2020 is the highest, which means that there has been increase in foreign aid in Kenya, in the financing landscape in Kenya, than it has been in 2020 than it has been in the previous years. And we can see that this is the time when Kenya was hit hard by the COVID-19 and there was decline in revenue generation. So increase in foreign aid, we can see that it was substantial actually to make, save the revenue that was lost as a result of COVID-19. And we can see that this is about 4% of GDP of the foreign assistance that is coming into the country. And we are looking at the largest funder or donor for Kenya has been the World Bank, IMF, and the United States. Consider the United States has traditionally been the highest funder, but it's declining, and the World Bank is taking over as the lead, providing World Bank, IMF, and United States providing over 70% of total foreign aid that's flowing into the country. And we can see that although health has been the greatest beneficiary of this foreign aid, but over the years it's declining, even though it still holds the largest share. And when we see how the trend about this foreign assistance is coming in, we see that in the future, that is post-2022, we're likely to see a decline in foreign assistance, because some of Kenya's foreign aid that was to come into the future years, 2023, 2024, was brought forward in 2020 and 2021, 2022, to fill in the very much needed resources as a result of COVID-19, and there was decline in Kenya's fiscal space. So this one came in handy to assist. It's also of concern to see that when Kenya joined low middle income, there are other donors who are shipping out because of Kenya's assumption that it has come of age, then it can take up some of the programs. For example, immunization, which is heavily funded by the Global Vaccine Alliance, Gavi, is shipping out by end of 2027, and therefore it will be required that Kenya will take over full financing for that. We also see other donors like Global Fund who are financing tuberculosis, financing HIV and malaria, and also they are scaling out because of Kenya's ability and the assumption that now it can take over the financing of these conditions. This one then recalls that Kenya should be able to bring in more funds from taxes, from exchequer into the health sector to be able to fund these gaps that will be left by the donors who will be exiting. Next. Another area that we zeroed down to see how the performance of public finances is faring on was health. And in health is interesting findings here. We looked at how is health sector in Kenya financed. And we can see that health sector in Kenya is majorly funded by two sources. That is government spending, taxes spending on the health sector, and out-of-pocket expenditure. So you see that out-of-pocket expenditure is a worrying trend, because with the UHC, the assumption is that all Kenyans who need healthcare should be able to access this healthcare that they need without being locked out because of the requirement for them to be able to pay. But we see from this research that over the years, there has been a decline in out-of-pocket spending, but it has stagnated, whereby we find that about 24% of total health spending in this country is out of pocket. And for any country to achieve universal health coverage, out-of-pocket expenditure should not be more than 20%. So any expenditure that's out of pocket above 20%, then that is indication that more Kenyans are being sent into poverty as a result of high health costs they have to pay, and those bills every year. And we see that looking at even the commitments that the Kenya Kwanza government has put in the first budget policy statement, where they have put forward their priorities, they are still committed to implementing a UHC, and it's anchored on NHIF. And we see that NHIF is has about 15 million members. But out of those 15 million members, 8 million Kenyans, from the report that they shared by end of June 2022, 8 million Kenyans were unable to pay their monthly contributions, and therefore they were dropped. So this is another condemnation of over these 8 million Kenyans who now will be required to pay for their health care from the out-of-pocket. And we are likely to see that going into 2023, they are likely to be higher out-of-pocket expenditure on health. And it's estimated that about 150 billion is paid for healthcare out of pocket. That's a lot of money. And looking at this economy, where majority of those people in NHIF are those from informal sector, and they're the ones that are being dropped from NHIF. And once they're dropped from NHIF, they have to wait for 3 months, finish their arrears, and for 3 months for them to come back into the funding. And what happens to them when there is a need for them to finance their healthcare during this time when they have been dropped? That means they'll have to pay again out of the pocket. So this is something we are calling that even NHIF should consider changing this condition, where the members are dropped out of the scheme for 3 months when they fail to pay their subscription even for 1 month. And another finding is that when we look at, again, NHIF, instead of it being a social health insurance scheme as it was envisaged when it was being started, it has remained basically like an occupational scheme for those people in the payroll, where you find that a person earning 100,000 paying 1,700 monthly subscription, which is about 2% of their gross income, and a person earning 1 million paying about 0.2 of their income to NHIF. So this continues to exacerbate inequality, where you find that NHIF is largely funded by the poor and least funded by the rich. But when it is a social insurance scheme, it should be funded according to the ability of the people who have to contribute into the financing scheme. And this is also, we saw that NHIF had proposed that there should be a reform where people earning over 100,000 could pay 1.7% of their income into the NHIF. But this was dropped by Parliament. And again, we have seen that this is a new reform that Kenya Kwanza government has brought into the budget policy statement, that they will be reforming NHIF to ensure that the people who earn more are able to contribute more into the scheme. But again, you know that NHIF is fully funded by members only. There is no single shilling from exchequer funding into the NHIF. It's also time we are calling that there should be an exchequer funding for NHIF for it to meet the needs of the Kenyans, because this is where largely NHIF and UHC are anchored, that is only going to be delivered through NHIF reforms. And another reform that we are also pursuing and encouraging that should be implemented in NHIF is to ensure that there is cost in terms of medical supplies. You know, the findings that even the Kenya Kwanza has indicated in the budget policy statement, they have clearly pointed out that there is over 70% importation of medicines and all consumables in the health sector. And you see, as my colleague Bernard was sharing with us, even fluctuation of the exchange rates, if we are importing all 70% of our meds, of pharmaceuticals and the consumables in the health sector, with the fluctuation of the shilling, the cost is going higher. The cost of that is pushed into the Kenyans who have to pay this out of pocket. So when there's local manufacturing of some of the health consumables and pharmaceuticals, this will help reduce this down. And the barriers that has been highlighted is, number one, a very bad tax regime that is very restrictive and high costs of manufacturing in the country. So when this is addressed, relaxing review of the tax regime regarding the health sector, regarding the manufacturing of pharmaceuticals, regarding the cost of producing those things here locally, so that local manufacturers can produce that competitively and can able to help bring down the cost of health. Another thing that we looked at is performance of budgets at national level and county level. And it's surprising that there is a very low absorption of health budgets at county level, especially the development budget. And from our findings, it shows that on average, 56% of development budget at county is only the portion of the budget that is being absorbed. So that means that for every 100 shillings put on development budget at county level, only 56 shillings is spent, 44 shillings is not spent. So what does that mean? And at national level, about 70% of development budget is spent. 30 shillings is not spent. So we have 30 shillings for each 100 shillings at national level not spent. We have 46 shillings at county level not spent. So that is 40 plus 30, that's over 70% of the funds that are not spent in the development budget. And about recurrent expenditure, that one, the absorption is quite fair, is within the accepted good practice norms. In sharing all these findings in this sector, we also looked at what are those reforms, what are those institutions, what are those guidelines and policies in the public finance space that are likely to affect how the management of the economy and management of public finances is being undertaken. And one of the things that we found out in far as the public finance management institutions is concerned, we have observed that the budget process is ongoing. We have just seen the draft policy statement come out, which sets out the priorities of Kenya Kwanza government and has called for public participation and opinions, and even the findings that we are getting from this research will also go a long way in informing the budget policy statement for 2023. We also observe that with the formation of Kenya Kwanza, there has been a number of institutions established to look into the economic recovery and management of public finances. And some of those offices, for example, we have the President's Council of Economic Advisors, we have the Economic Transformation Secretariat, which is a unit, we have the Fiscal Affairs and Budget Policy Unit, and we still have the National Treasury, we have the Central Bank, we have the Economic Development Unit. So there is confusion as to what role all these institutions are going to play in regards to the economic recovery and management of public finances. There has been each time commitment about the national tax policy, which is going to provide clarity in how businesses and investors are going to be taxed. This policy, national tax policy, is still incomplete. So again, we're calling that this completion of national tax policy should be hastened so that it can bring certainty into the tax regime and tax environment in Kenya. We also say that Parliament should expedite the approval of audit reports. You know, up to now, the counties are given money on the basis of 2016-2017 audit reports, which is quite outdated. This is a lack. So calling that expedite the approval of these audit reports. And finally, we see the creation of extra committees at the National Assembly, so we hope that there will be proper and effective oversight of our public finances that will bring about sanity and bring about increased hope and order into the management of Kenya's economy and public finances.
I would like now to welcome our country lead and head of programs, Bwana Daniel Dirangu, to give up a wrap-up and a spotlight the key messages and the implications from our report. Karibu Dan.
A lot has been said here. It's a summary of a big report, and we know we may not have clarified everything, but we want to note just a few messages as we wrap up. Key messages from this report, but also things that we'll keep monitoring together with ourselves. We hope that because the media has a bigger audience, you also assist us in keeping track on some of these things. So from before COVID, there was reasonably strong poverty reduction. And we have heard even from the presenters before that poverty reduction or poverty levels in Kenya have continually gone down, but we have not reduced poverty as we had anticipated the pre-COVID crisis and also other crises that have come up, including the global instability, global level instability. So we still have not achieved the poverty reduction levels as we should have achieved them, because even with the rebasing of the poverty indices in April of 2022, the poverty dynamics have not changed. More than 25% of the Kenyan population still live below the poverty line, and now the poverty line is $2.15. So most, more than 25% of Kenyans cannot spend more than 300 shillings a day. So adding to other parameters like out-of-pocket health spending, that is also catastrophic, we see that there is need for us to keep an eye on what the government is doing to support that. And we are working towards achieving that. So, and for so many years, Kenya has deferred fiscal consolidation. We've seen in the current budget policy statement, the government has proposed a budget of 3.6 trillion for spending in the financial year 2023-2024. Granted, the deficit has reduced from about 800 billion to 734 billion in the next year, meaning that also the fiscal deficit has reduced from 6% of GDP to around 5% of the GDP. However, we have very high ambitious revenue targets, because we are estimating that in the next financial year, the government will collect on above 16% of the current collection. So if the government anticipates to collect 2.4 trillion this year, the anticipation is that cumulative revenue will increase to 2.9 trillion in the next financial year. So, and we have in our report evidence that some of those targets have been overly ambitious, unachievable at the least, but there are reforms that have been proposed, some of it very popular including the telcos, the one that tracks the transaction through mobile phone transfers. And our anticipation is that perhaps that will close in the gap. The government has also proposed to collect, rather to tap into the informal sector that has a revenue potential of about 2.8 trillion. And we are looking to see whether the government is, the Kenya Kwanza government will be able to tap into the informal sector. It has been an ongoing conversation even with previous governments, but that has not been fully achieved. So our eyes are on that. The other key message is as we look into fiscal consolidation, because of the growing economy in Kenya, there is some safe space to allow us to get to fiscal consolidation. But there are risks to that. It's not a fail-safe policy. There are risks because as we look towards reducing our deficit, internationally, there is conflict going on that has increased our fuel prices. There's also the currency that has continually been devalued. So our exchange rate is going up and up as days proceed. So it may not be that easy to achieve fiscal consolidation without tightening some areas. But our anticipation is that the government is going to institute measures that does not affect social spending, like in key sectors of health, agriculture, and education, as we pursue fiscal consolidation. Our debt distress also is likely to come from high debt distress to medium debt distress. But that is if we stick to the plans. If you don't stick to the plans, things are about to they are worse now, but they are likely to worsen a bit before they can become better if you're not able to stick to the plans. So those are some of the key messages that we are presenting out there. And the implications of that is, as we move forward, is Kenya has the macroeconomic outlook as has been presented. We've seen that the economy has over time increased, but it has not gone back to the pre-COVID projections. And our anticipation is that with the reforms that has been proposed, that the economy is going to strengthen as we pursue fiscal consolidation, as we pursue social spending, as we pursue increasing our revenue from local or rather domestic revenue, that we are going to portray a more stable economy as we move forward. Then looking at fiscal implications, projections suggest growth of revenue. As we've said that the proposed revenue projection in the current budget policy statement is quite ambitious. I think could be the highest we've seen so far at 2.6 trillion against a collection of about 2 trillion. So we are quite ambitious in that, and our anticipation is that we'll get there. Then emerging issues, sector financing, the UHC and NHIF reforms, at that sector level, what is happening in health spending, because since 2020, the spending on health as a proportion of the total budget has continually gone down. For 2023-2024, the proposed is about 4%, between 4 and 5%. So, and the requirement is for us to have a minimum of 15% of health spending as a proportion of the total budget. So there's those emerging issues that we are looking out to. Then the implications of that and how we'll be tracking them is debt and fiscal deficit remain high at 4.6% currently, according to the proposed draft budget policy statement. The EAC threshold is 3%. So we're still significantly higher than that. And based on the in-year budget revisions that happen, sometimes it doesn't even give us a very accurate picture, because if the supplementary budget comes in and revises the revenue projection downwards without a proportionate revision of spending, then it means the deficit will widen. Then we are looking at that there is no room for increased expenditure or government spending, because we have debts to pay, we have shortfalls in revenue collection, so there is no big room for that spending. And the government had proposed, the Kenya Kwanza government had proposed a reduction of 300 billion in the current budget. We're still looking out to see where that is going to be reduced, because we also keen that the government is not reducing spending on otherwise sectors that protect the most vulnerable and the poor population. So the fiscal consolidation in 2023, 2022-23, and also 23-24 moving beyond is very urgent and calls for action for us to move towards that. So now we are going to track some of these issues highlighted here. One is whether the government sticks to its fiscal consolidation plan. As we've mentioned, we are currently at 734 billion, 4.6% of the GDP, and that is a significant reduction, and we'll be on the lookout to see whether that sticks through to the budget, as the government does budgets in April, and then whether projected increases in revenue come to pass. So the significant, ambitious revenue target of the current financial year, as I've suggested, from a base of 2.4, is growing by about 16%. So it will be a pleasant and welcome miracle if we achieve that as a key investment, government reducing fiscal deficit, and also the government ensuring that we are not also exposing the vulnerable as it taps into the informal economy. Then whether the IMF downgrades Kenya risk of debt distress. So because of the sustained economic growth, we anticipate that the debt distress is going to reduce from a high debt distress to a medium debt distress. Will give investors confidence, there'll be more investment, and there will be a steady growth in the economy. The impact of fiscal consolidation on county government finances. This, as has been seen, the real increase in county revenue in the proposed BPS is from 370 billion to 375 billion, is about 1.4%. But the county governments cannot afford services at 370 billion with an inflation of 9%. They are more now spending more expenses in fueling. They spend more expenses in construction. So the budget increase, the 370 to 380 equitable share, may not necessarily achieve the priorities that the county are looking forward to. And as champions of devolution, we are looking out to see what the Senate and the committees of the National Assembly comes up with to protect the gains of devolution in these inflationary pressures. And finally, the evolution of health budgets, as we have mentioned, there is a significant increase in the proposed BPS from 121 billion to about 148 billion, but still, as a proportion of the total budget, this is not in line with the required threshold. So how much is the government spending in the health budget as we pursue UHC? The NHIF reforms, is the government committing to provide exchequer releases towards NHIF to support and increase the contribution by members.
Now, over the next few minutes, I would like to officially, to welcome our CEO to officially launch and release this report, the Macrofiscal Analytical Snapsot Kenya, focusing on the financial year 2022-2023. Karibu sana Bwana CEO. I will also invite our country lead to join in.
Ladies and gentlemen, the Macro Fiscal 2022-2023 theme is on economic recovery pathways amidst inevitable fiscal consolidation and inflationary pressures. The Kenya economy exhibited remarkable resilience by bouncing back to 7.5% growth in 2021. From a 0.3% contraction in 2020, caused by the adverse impacts of COVID-19 pandemic. However, global events such as ongoing Russia-Ukraine conflict, high inflation rates, and climate change-related shocks are likely to erode gains made from the economic recovery strategies, slowing the Kenyan growth to about 5% in 2023. Growth in public debt is expected to exceed 70% of GDP in 2023. And the high ratio of debt service to revenues has resulted in the elevation of Kenya's debt distress rating from medium to high. Moreover, the tightening of global monetary policy has created stringent financial conditions, thus prompting fiscal consolidation as the most viable solution for the government of Kenya. Going forward, the Institute of Public Finance outlines the following key issues to monitor, which are detailed in the Macro Fiscal Analytic Snapshot for 2023. 1. Whether the government sticks to its fiscal consolidation plan. In addition to current projections, the government has stated that it intends to cut its expenditure in the supplementary budget for 2022-2023 by 300 billion, which is approximately 10% of the budget to ease fiscal pressure. The feasibility and all realization of this austerity measure is a matter of great interest to this country. Number 2, whether projected increases in revenue come to pass. As a think tank, we are keenly looking at government's medium-term revenue projections that appear more realistic. However, based on past realities, especially the ambitious medium-term revenue strategy that intends to raise tax revenue to 25% of GDP by 2030, there is a lot of work that needs to be done to ensure our ordinary tax revenue are met. Number 3, IMF is a lender of last resort. It cannot be a partner. The moment you find yourself with IMF, just know there's something wrong you are doing. IMF has, raised our debt distress level from moderate to high risk. We are monitoring whether this moves from high risk to moderate. And our projected growth and deficit reduction will potentially reduce the debt to GDP ratio over time. Therefore, there is an opportunity that we have as a country to reduce our risk of debt distress in the coming years, but this will require adherence to our fiscal consolidation plans. And what do these fiscal consolidation plans mean? 4, the impact of fiscal consolidation on county government finances. According to the budget review and outlook paper projections by the National Treasury, real county transfers, which is equitable share adjusted for inflation, are set to decline for at least the next 3 fiscal years. This should be monitored closely, since if it is carried through, it will have a major implications for service delivery going forward. It is important to understand that this government had also committed to full devolution. We're still aware that there are still functions that are being undertaken at the national level, at the national government level. And we would wish to see the commitment to the full devolution being undertaken, considering that service delivery happens at the ward level. So we want to see resources following functions. Finally, we are very keenly monitoring the evolution of the health budget and NHIF reforms. It is important to see whether in financial year 2022-2023, the current year, the supplementary budget expected to be tabled by the government in Parliament will maintain the health budget below the 2021-2022 level until 2023-2024 as legislated by the previous government. It is also important to monitor the implementation of the National Health Insurance Fund reforms, particularly on the premiums that are supposed to be increased to boost the income of the NHIF. Ladies and gentlemen, thank you very much, and I'm pleased to invite our country lead and our head of research for us to officially launch this report.
Thank you to our partners, our funders, our stakeholders, our reviewers. We are grateful. To our viewers and our audience today, especially those following us online, we thank you very much for your time, and let us keep the conversation going. Let us tweet us, tag us on our social media handles, cite us in your work. We are open. The report will be available on our website. And for those who are present today, you'll be given copies together with the press release.